Welcome back to the Resurgence Athletics podcast. My name is Dr. Ryan Goodell.
I'm Dr. Lucas Noguera.
And this is episode 8.
All right.
We're talking about concussions.
Let's do it.
So have you ever had a concussion?
I have, yeah, in high school, playing soccer.
Like formally diagnosed?
Formally diagnosed, Yep.
Ooh.
How about you?
We're going to dive into how concussions happen later, but I have never had a formal diagnosis of a concussion. I have gotten hit in the head quite a bit playing baseball.
Fair.
I was a catcher, so you do come into a little bit more physical contact in that position while you're playing. Not as many other ones, but mostly it's like the ball, getting hit with the ball.
Yeah.
And when runners come home and sometimes bats hit you, but you're wearing a helmet and a mask. You're normally well protected. But no concussions for me.
Okay.
Officially.
That we know of.
That we know of. So if I start acting weird, maybe screen me.
So what is a concussion?
Concussion. So the formal diagnosis of concussion is there's some type of traumatic blow to the brain, causes a cascade of like chemical changes to the neurons in your brain. Concussion can happen for a couple different ways. Most people are familiar with it because of an impact, but you don't necessarily need an impact. So think about like car accidents, whiplash. So if there's enough velocity moving forward and then you come to like an abrupt stop, your brain's just floating in there. So your brain's still got some velocity going with it, and it can hit the inside of your skull, and then it can also hit the backside. They call that a
counter
coup injury too. So impact isn't always necessary for a concussion. So if you like are at a rock concert and you're headbanging hard enough, you might
be concussed.
You could concuss yourself theoretically. So I don't encourage that behavior. Those are, typically some of the more common ways that people will sustain a concussion, and that impact it's like a brain bruise, right?
Yeah,
that disrupts the cellular function of the neurons of your brain and can cause chemical changes because that's how the nerves work. There's impulses going around, and there's things physiologically that are happening in your brain, and that can cause that physiology to become significantly disrupted. And then those are the chemical changes that we're talking about. And there's that cascade of just effects that stem from there. And then, risk factors for having a concussion. We talked about a few, but, what is the most common cause of concussions? Like most people think athletics.
It's not. So it's more actually traumatic falls and things of that nature where, you go down unexpectedly, you hit your head, you don't have that response time. And we usually see this, and at least I see it more in my older folks, right? Balance, coordination issues. I actually told you I had someone like earlier this week who sustained a fall, hit their head, and that's all kind of the MOI of
people falling and hitting their heads. No more falling and hitting your head.
We don't like falls.
Falling and hitting your head is the number one cause of concussions, which is not something that I think people normally think about. Being old and falling puts you at a very high risk of concussions, even though we normally think about concussions in relation to sports and athletics and things like that. If we do have a concussion, what are some of the most common causes, signs, and symptoms of them, I guess?
A lot of times you'll lose consciousness. But if you don't lose consciousness, you can still be concussed, right? So you would look for headaches, light sensitivity, noise sensitivity, nauseousness, balance impairments, things of that nature. Those are all those signs and symptoms that, you might have sustained a concussion.
Because normally we think about concussions and it's like most people think you have to lose consciousness to have a concussion. Those are some of the more subtle factors. If you don't lose consciousness, there are very subtle things that you can pick up on that can indicate you had a concussion. If you're an athlete, let's say, and there is a suspicion that you may have had a concussion, what is the typical protocol around that?
Get them off the field or court, wherever they are. Immediate stopping of play at that moment, and then further assessment is then warranted, right? So either seeking a medical professional. There's some tests that we'll talk about soon that you can do to screen and actually get an assessment if they are concussed or if they might have those symptoms, to make sure that they're not sustaining further damage
Yeah.
right there.
Yeah. And if you remember when we were younger, there are concussive protocols or baseline measures to help objectify, like, have you actually had a concussion? Well, how do we know? We have something to compare to previously that we have an objective baseline measure for you. And if you remember high school sports, what was the test that we all had to do?
Was it impact?
I believe it was the impact test, computerized test. So basically it's a test on the computer. You go through all these questions and little interactive things, essentially to just test your cognition and your reaction time and things like that, and your mental acuity. And it gives you a baseline score. And so if you ever do have a suspicion of a concussion, there's a certain margin of error that test is performed within, and you need to be able to score similar or better than your baseline score. So you're out in the field, say you're playing soccer, you go up for a header, get rocked,
exactly,
right? You don't lose consciousness, let's say.
Sure.
What do you do immediately? You probably would want to get out off the field.
Definitely get off the field.
If there's
for your own good.
any suspicion,
like
just from the conservative management standpoint, because the ramifications to continue to play with a concussion are massive. Like that is not a risk you want to take. And then we can objectively quantify, did you actually have some type of cognitive impairment or brain damage issue from the concussion, and compare it to this prior baseline score that you've had. There's also some neurological testing that we can go through. What are some of those?
SCAT5, right?
SCAT5.
Things like that we can do. Like it's more of, or you name a bunch of random things, so animals, colors, and you have to have the person recite that back to you with the most that they can remember. I don't know if I'd even do well on that right now, but that's one test that you can do. And then, on a more of a PT standpoint, we have the Glasgow's coma scale, right? Where then it's assessing also just, vision, motor control, and things like that to see if there's any impairments there as well.
Concussions do fall under the category of brain injuries. And that is a bigger umbrella of terms. Concussions are just one component of that, because within that, you also have strokes, you have infections, you have any other form of like brain impairment that it causes a brain injury. They're classified under. So these are, serious things. Concussions are not to be taken lightly. Just because you can't see it doesn't mean there isn't some serious stuff going on.
It's a brain injury, right? So if anything with the brain, you want to be careful.
Yeah, it is a brain injury at the end of the day. You got to be very, very careful with those things. And some of the other tests that we typically do, which can also be used as treatments, are stuff like convergence, VOR reflexes for our head, any of those like nervous system tests with our vestibular ocular reflex, right? So those things can kick some of the symptoms in for people when you test those, like nausea, dizziness, double vision, things like that. I mean, just with the convergence, that's an easy one. Like, just here, look at this, and then let me bring my finger closer to you, and you're like, whoa, I'm seeing double from like 5 feet away. That's not a good sign. Standard is 8 centimeters, I believe. It's very close. Like, you got to be like, and so some of those reflexes, because our brain and our eyes and our vestibular system and our inner ear, they're so delicately interconnected. Manipulating any of those, if you have a concussion, can cause pretty debilitating symptoms.
And who's most at risk, Ryan, for concussion?
In sports or in general?
Sports.
Sports.
Let's go both.
Both? Well, we touched on that earlier. So for, in general, our elderly population, but in sports, any contact sports, you're looking probably boxing and MMA, probably high up there on the list. Football, soccer, rugby, contact sports.
How about age besides our elderly folks?
Kids are especially more vulnerable too, especially in the developmental years, because your brain doesn't stop developing until your late teens, early 20s, some studies say. So if you sustain a concussion during those years, that can be very detrimental for you, especially if you're considering the factors like, you're in school, you are actively in the process of learning a lot of like life things and information that's going to benefit you later in life. So I had some experiences in high school and college. I knew some people who had concussions, and you have to take time out of class. And some people missed an entire year of school. They have to sit out. They get delayed in that aspect. So having a concussion in your early years can really have a significant effect on your life.
I feel like that also with that age population, right? The younger they are, unfortunately, I feel like sometimes it just goes dismissed more often than it should, right?
Yep.
Just because, they're a kid, they hit their head, they're fine.
Yeah, running along on the playground and then just get clotheslined by a metal bar somewhere.
Exactly.
Right? You ever see a kid do that?
Run into a goalpost.
Yep, run into a goalpost. That's exactly.
So, important to screen at whatever age, really, and not going to have that long-term effect that we talked about.
Right. If they do happen, right, you're at increased risk for more to happen in the future, because we do know that prior injury is the greatest risk factor for future injury.
Sure.
Say, for example, now we've started to compile a couple concussions. Like you've had a couple, you're on your second, third, like you're at way higher risk. Like I've seen and heard people have a subsequent concussion, like if they've had a handful, you'll be walking down into your basement and you hit your head on like a beam, or like getting in your car, you hit your head on the door frame. It can be as sensitive as that if you've had previous concussions, and then you can be out for months because you just someone bumped your head. So there's some long-term effects to this as well. And do you want to talk about some of the long-term effects?
Obviously, memory, cognition, all of that, so you see it like if you're having that many episodes of traumatic brain injury, right? You're going to be more forgetful down the line, things like that, or you're more prone to that. CTE as well, right? So it's just that chronic damage of the brain tissue, and all of that will then, in turn, focus on or impair balance, coordination, your visual acuity. All of that is also all those long-term effects that can occur.
And that's a big concern, CTE, for the NFL and the football players.
Oh, yeah.
There's been some unfortunate stories with some of them. I think that one of the more highlighted ones was Aaron Hernandez. They've been changing some of the rules around sports to decrease the risk for concussions. We spoke about that in our prior podcast with the NFL rule changes. And even in training camp, they do have the option this year to wear those Guardian helmets. Have you seen those?
I did.
They're the big padded things that go on the exterior of the helmet. No one's wearing those.
I don't think so.
I don't think.
I wouldn't want to wear that.
If you're in the NFL, I think you probably think they look ridiculous. And why have more mass on your head than you need? There are some long-term risk factors if you continually have concussions, and like a sport like football is a great example. They can just be micro traumas. They don't have to be things that go starkly noticed. But again, that just repeated head trauma can cause some significant effects in the long run. If someone's had a concussion, what can they kind of expect in the first beginning stages of that, and going through the rehabilitative process to get back to where they need to be? What's that typically like?
So you definitely want to follow a protocol, right? So kind of like a return to sport, gradually bring them back into that. And then the biggest thing is monitoring the signs and the symptoms, right? So like you said, like even just like some VOR or stabilization exercises that we do might trigger some of those symptoms that we spoke about earlier. So definitely being very, vigorous with that return to play and making sure that you're not aggravating or worsening their symptoms. It can be a lot for the athlete, right? Just because it can take some time, right, to get back to where you want to be, especially if you're a higher level athlete and you're literally doing some visual exercises and it's like, I can't even do this yet. How am I going to go back onto the field? It also comes back to like that mental component of like concussions as well, and like what it does to an athlete.
I think later in those rehab stages too, like you might not be passing your objective tests to get back yet, and like you feel fine in your day to day. Right, but when you're cognitively and mentally pushed and put under that test, it can expose some things that you're still a little deficient on, that you might not notably feel, but that stuff's still lurking under the surface. And you are, because you've had a concussion, you're still at risk to get one again. I think notably an interesting athlete highlight in that regard was Anthony Rizzo. Had a concussion. He was going back to first base, and there was a collision at first base. He hit his head. So prior to that, I think he was batting, let me see the stats here, 304 prior to his concussion, with 11 home runs in 204 at-bats. So that's a good amount of at-bat.
Did that drastically go down?
And so
I'm assuming.
he actually passed his concussive test.
Okay.
And this is a crafty thing. You got to watch out for some of these athletes. They're very good at compensating for things, and they can sometimes pass tests even. So this is why if there is a suspicion, it's just better to just stop in certain situations. And I believe he has had a history of concussions too.
Okay.
So even more so makes me think, let's just stop, pass a test. But then in subsequent games, actually, according to here, he had another 169 at-bats after this event. That is the hard set delineation between pre and post this event. Post this concussive event, batted only 172 with 1 home run in 169 at-bats. That is a significant drop-off in performance from a subtle cognitive decline probably after a head trauma. But again, you're talking about baseball, that's hundredths of a second, which can drastically, clearly have a significant effect on some of the objective measures of the statistics that we saw there. Time to return can be very lengthy. Athletes need to be patient with it. It can be very, very subtle. And you can cheat the test. Some athletes can cheat the test. And, you know, you need to be honest with yourself about that too, because it is your safety at the end of the day. And we want you to have a long athletic career. We don't want you to not be able to play anymore because we're afraid that you're going to hit your head.
Won't get cleared.
Right? You won't get cleared. I think lastly, you know, we got to talk about some misconceptions about, you know, concussions. Are concussions only dangerous if you lose consciousness? And we've talked about that a little so far.
We touched on
but
that.
That's absolutely false. Like, you do not need to lose consciousness to have a concussion.
Times you actually don't, right? And that's why a lot of them just go kind of slipped under the rug.
Right.
Like, oh, like, we're fine. We're young. You know, we're a high school athlete. We can keep going. But definitely going by all these protocols is a safe bet, and that's what you should do for yourself.
Right. The second one, I guess, is kids recover faster from concussions because, you know, kids, they're young, they're healthy. Sometimes orthopedically, they heal a little bit faster. But do they heal faster with concussions?
No.
No, that is also false. They are a little bit more vulnerable. You know, they're, like we said before, they're still developing. So that is
Engaging in play more.
a higher risk factor for them. An emphasis does need to be taken regardless of the severity of the concussion. We do need to still approach it with the same level of diligence and attentiveness to detail when it comes to those things, because you only get one nervous system, and your central nervous system does not recover like the rest of your nervous system.
Exactly.
So you get one brain, treat it right.
Take it lightly.
Don't take it lightly. So if you have any questions about concussions, if you want us to talk more about this topic, this is something that not only athletes struggle with, but also people, like we said before, elderly people fall, they hit their heads. That is the highest risk population for that. So let us know what you think down in the comments. Do you have, or have you ever had a concussion? Like, share, subscribe, hit all the buttons everywhere. And we can't sign off here without talking about our sponsor for today, which is us again, Resurgence Physical Therapy. So if you are in need of any physical therapy services in the New Jersey area, please feel free to reach out to us, and we will see you next time.